Whenever you're ready. Okay. So we'll call the meeting to order. There's official notice of publication here. Copy of the Open Meetings Act on the south wall. And we'll take roll call. Oh, so.
Here.
I'll work it. I'll work it. Go ahead.
Here.
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 Okay. So I'll help you walk through it. Just follow me on it. I'll walk through it. Item 2 is approval of the minutes for the August meeting. Is there a motion? Is there a second?
Second?
Okay. Espinosa.
Yes.
Wise.
Yes.
Myself, yes. Gray.
Yes.
McNally. Alrighty. Item 3 is public comment. Any public comment? Seeing none, we'll go down to item 4. Note for the record, we're going to remove item C to next month because the resolution came out, but we didn't have the policy. Item E, we're going to discuss that a little bit, but we're not going to take action on today because some people got the material. And I think from some conversation we had, item D that will be approved today, we're going to run that through that committee just to get a little vet on it and some questions. So with that, I'd like to ask for approval of items A, B, and D.
So moved.
Moved by Wise, seconded by Gray. Espinosa.
Yes.
Wise.
Yes.
Yes for myself. Gray.
Yes.
McNally. We'll go now to Carrie, if you want to now end this, just do a little opener of E so everybody can be briefed for next month.
Good morning, board members.
Morning.
Just a little bit of background about the resolution E. I got this from Dr. Pork pretty late in the day, and I've actually reached out to the contact that came from Creighton University. So the gal is named Kate Nolte, and she's actually a member of the section, the Alcohol, Tobacco, and Drugs section with the American Public Health Association. So this is really the connection between Creighton, this paper that came out, and then the sharing of this information with Dr. Poore and Commissioner Rogers. So what this is, it's a white paper. So this is really bringing forth an acknowledgement and more information for consideration. This is across the nation. And they're asking for endorsements of this white paper. I've had a chance to take a look at it at pretty high levels, so I think this is a great opportunity for the Internal Health Equity Committee to begin to take a look at this and see what this might mean for our community. But as I developed the resolution for consideration, I brought forth 2 data points. One, we recognize, and this has been out through CDC, that our use of e-cigarettes, so tobacco specific to e-cigarettes, has increased within our youth population, both at the middle school and the high school level. The second data point that I referenced was out of the 2018 Youth Risk Behavior Surveillance System, which also recognizes the increase in the utilization of electronic vapor products. One of the things as part of background within this document, and Change Lab Solutions is a very well-known partner within the public health community located out of California. They've done a lot of research and recognize that retail tobacco facilities or entities are heavily populated within Black and brown communities. So this access to tobacco products, e-cigarettes, is much more prevalent within the Black and brown communities, and then the connection to the health disparities and the health outcomes that are impacting not only the adults but especially the youth because it's extremely accessible. So if you take a look at this, this document, I kind of just high-level synopsis with each of the buckets. And I'll provide just a little bit of background as we've started to take a look into this. The one consideration that they're asking within values is that right now enforcement really comes from law enforcement. So if there's known to be an illegal purchase of or use of a tobacco product, then law enforcement comes in. What they're proposing is that really takes away from the law enforcement side, but really talks about the public health impact and the public health component. So much like public health is coming in with retail food and doing assessments and a lot of education and information, this could be something that public health would consider. The funding of this would actually come from the tobacco tax is what they're proposing. The second bucket really looks at what they call state PUP laws, which are youth purchase, use, and possession laws. My initial kind of purview into this, and I added this to the resolution, was we actually have 2 laws on the book. There may be others that I just didn't have a chance to take a look at. But it references misdemeanors, class 3 and class 5 misdemeanors. And what they're really doing is taking a look at that and what is that impact to the school districts especially. I did have a chance to take a look at OPS's policies and procedures for youth. And they are, in my opinion, very restorative justice focused. So I think there's 4 levels of warning within OPS as far as violations. Tobacco use really falls within that first and second category. So it's more education, counseling, referring to support. So I think that they've approached that in the way that this is what they're asking us to do. I didn't have a chance to take a look at any of the other school districts. The fourth bucket is really around this enforcement practice. So if you take a look at our state laws, a class 3 misdemeanor and a class 4 misdemeanor, which tie into what they're asking, are fines of up to $100, or a class 3 misdemeanor is a fine up to $500 or prison time, or both. So it really is taking a look at how those laws are impacting our youth, and then what does that look like on the record and that type of a thing. So what can we really do to take a look at those laws and how it's impacting our youth. And the fourth bucket are really policies specific to retailers. So how are we holding them accountable for the violations and the fines? The one nice thing that I saw as part of the recommendation is that there are compliance checks on the retailers. We actually do that currently within our tobacco-free tobacco grant dollars that we get through Region 6 and in partnership with Omaha Police Department. So we are looking at some of these things, and so I think this is just kind of, again, very high level. I didn't have a chance to take a deep dive into this, but could be something that, with the board's approval, this the Health Equity Committee can begin to take a deeper dive into this and then bring some recommendations back forward. In addition to considering the support of this white paper from the American Public Health Association.
What is the timeline for needing?
I don't know. I sent an email to Kate to get a little bit more about just the history of why this has come up and how this white paper was developed across the nation from the section under APHA. So I haven't heard back from her, so I'll see what I can learn. Yeah.
Okay. There just is a lot to unpack,
Yep.
and for me, it was the question of what is the role of the Board of Health. If this isn't endorsed, does that mean we are accepting the responsibility of pulling school districts together to look at their, what? So with endorsement, what does that mean? What responsibilities come with that?
And I can pose that question to her and see what kind of additional information I can get.
Okay.
So Carrie, who from Creighton is pushing this one, asking this?
Is what?
Who from Creighton?
Kate Nolte, Nolte.
That's
I don't know her. That's who sent the email out to Dr. Port, so
Okay. All right.
I
I'll
just reached out to her. Yeah.
Okay.
I'm not sure what division or department she's with either.
No, I think I know where.
Okay.
Anybody else?
Let me ask, Carrie, would it be, I guess, what would be the feasibility of, because I think this document, the health department is doing this document, if we pass it, it's an appropriate thing to do, but I'm looking at some of the information here, and I'm wondering if we ought not have other local government subdivisions look at this, and perhaps maybe adopt it as well, to give it strength,
Okay.
in terms of moving forward.
That's a great point. And I'll share that with Kate when I ask her about the timeline. I can't imagine this is hurry up and do it, because I think if they're looking at this across the nation and the support as this comes out as a white paper, I think that's a great point as far as how much other partners we can include in the conversations.
I think they can vet that through the committee.
I'm sorry?
I think we can vet that through the committee, because I got
Okay.
some ideas on that. So, okay. Any other questions? All right, Karen. Thanks.
Okay, thanks.
So, just real quick, could somebody let people waiting in from that, if we're working off that computer?
But they can't.
They can't hear anything
or
anyway?
see. Yeah.
Okay. All right. Then, we'll go with, let's go to item 5, and, the coronavirus update. Dr. Ford.
Good morning, Board of Health. Sorry for some of the technical difficulties. I think we need to get back to our normal Board of Health meetings. So I'm going to start out with giving you 4 numbers. 25, 10, 2.5, 1.2. I thought instead of just filling you with thousands of numbers, I want you to kind of remember these 4 numbers. 25 is the number of people who have tested for COVID in Douglas County, 25% of our community. 10% is the number of people who have been positive after they tested for COVID-19. 2.5% is the total number of residents that have tested positive in Douglas County. 2.5% of our population. And 1.2% is the mortality rate.
1.25?
1.2%. So 25, 10, 2.5, 1.2. So, and if you want to know the number, we have tested 141,093 individuals, 14,622 tested positive, and we have 179 deaths that we are reporting as of today. As of last week, actually, and you know, we always look at this by week, not so much by day, because the days can change depending on when results come in from the laboratory. But last week, we had 529 cases in Douglas County, and that has been the lowest for the last 8 weeks. And our positivity rate also was 7.4%, which was also the lowest in 8 weeks. So for comparison, the week when the City Council implemented the mask mandate, which was the week of August 15th, actually implemented it on August 12th, the positivity rate at that time was 10.5%, and now 7.4%, potentially 30% lower than it was when this was implemented. The case count at that week was 836 and is now 529. So 307 individuals less, 37% lower. So, you know, I always look at something positive, and I do think we can say for the last 4 weeks, we have seen some positive trends. We need to continue to see those trends. And when I sit back and look back on the week of July 4th, we were very concerned. We were potentially at the same level as we are today. However, after July 4th, we saw an increase, and we saw an increase through August 11th, actually, I think was our highest day. And then from then on, we saw it decrease again. So what we are now, we are at the level of the week of July 4th. But what we want to see is we want to see this trend continue. But in general, it is a positive message, because we have also seen schools opening, we have seen K-12, we have seen colleges go back, and still with all that, we have seen a slight decrease. So it is a positive for our community. when we talk about age ranges, of course, as always, our highest age range is 20 to 29 years old. We have 21% who are in that age range. If we look at it a little bit broader, 36% of our age of our cases are in the 15 to 29 years old. 36, so a third, 15 to 29, young adults, high school, college, potentially. When we look at race, a lot of it hasn't changed. 8% in Asian, 10% in African American. Hispanics make up 34% now, and whites 39%. However, data is only as good as you look at it. And so our staff is fabulous. They do, our data analysts, I can't say enough about them. They looked over the last 2 weeks. What are we seeing in regards to race and ethnicity? And it is striking. So in the last 2 weeks, our Asian make up 4%, African American 8%, Hispanics 17%, and our white population 52%. So you clearly can see the shift that we are seeing compared to in the beginning of the pandemic. So I think we just need to keep aware of that. Hospital utilization, it was what from the beginning the governor said we do not want to overwhelm the hospital systems. We want to flatten the curve. And so as of yesterday, we are reporting 83% of our med-surg beds are available, are occupied. 83% of our ICU adult beds are occupied too. 72% of our pediatric ICU, and we have a total of 95 COVID patients in our hospitals in this region. That is high. 95 individuals in the hospital, that's high. That's actually the highest since 25th of August. So, but the good thing is ventilator use, we have 19 individuals on ventilator use. And so overall, that usage of ventilators has really decreased from the beginning. And we had a call yesterday with the medical center again where they are saying there are many fewer patients that they are putting on ventilators. And they do think one of the things is remdesivir. Having remdesivir there is helping to decrease mortality and helping potentially put people on ventilators. Our death, like I said, 179. 75% of them are 65 years and older. 63% are in whites, 16 in African American, 17 Hispanic, and 2% in Asians. Let's talk a little bit about mass vaccination. A lot of efforts going on, nationwide. Of course, you know that 3 vaccines are in phase 3 at this time, and they actually have potentially more than 20,000 participants in those trials. And I think we need to recognize that during a normal vaccine trial, there are potentially 5,000 participants in a trial. In these trials, they have 20,000, and they are trying to get even more, like 30 to 50,000 people, to really increase the knowledge, so to say, what is the safety and efficacy of these vaccines. The National Academy of Science has put out a priority list framework last week, potentially, and the public could comment on it, where they are proposing what would be the individuals that would be in the highest priority group. Of course, healthcare provider, emergency responders, but also potentially individuals who work in meat packing industry, because we have learned from coronavirus how detrimental it is to that community and so on. So public comment period is going on for those. And we are internally making plans, and I think a lot of work is going into that because there are going to be challenges. these vaccines are going to be different. They all are going to have different cold chains. Some of them are going to be below freezing, 70 degrees. Some of them are going to be refrigerated or so on. So, you know, we need to work through all those different scenarios. The other thing is potentially they are requiring 2 doses. 2 doses that are 2 to 4 weeks apart. Again, that's an additional challenge. The other thing I just want to point out to you is, you know, a vaccine is only going to be as good as if people really are accepting it. And therefore, that safety measure is really, really important. I think we'll have a lot of information in regards to safety. However, we won't have information in regards to long-term safety because it's the way this vaccine is being developed. So a lot of struggles will be ahead of us to really make sure that everybody feels safe, and everybody who wants to get a vaccine can get a vaccine. We make it available to all of our community.
Dr. Ford?
Yes.
When it comes to those 3 vaccines that are in process, if they all get approved, do you anticipate communities will have access to all 3 options, or are they dispersing one option to one part of the globe? And
That's a very interesting question, and that is actually being discussed widely right now because potentially not every vaccine is for every risk group. So there are potentially going to, you may have 2 or 3 vaccines in a community, and it may be one vaccine is better taken up by the elderly, and therefore that is the vaccine, you know, like we have during the flu season. There are different vaccines given to different age groups. And so the thought is that probably the same thing is going to happen with these vaccines.
okay. So it's complicated by not only how you disperse them, but there may be multiple vaccines, therefore you need to figure out
Exactly.
where to
exactly.
get
And it will say, you know, vaccine A is really recommended for those 65 years and older. Vaccine B is really for the young
immune
population.
suppressed and younger or whatever.
Yeah. So it really is going to be a logistical challenge. However, I can tell you, every day I get an email from some pharmacy or organization who steps forward and says, we want to be here and help you. What can we do? And so I think everybody realizes that this is going to be a big endeavor and everybody wants to be helpful and play part of it. So that's really positive. So let me talk about a few other things. Long-term care facility, they are going through testing right now, different type of testing that is recommended by CMS. They have to do some baseline testing with their staff. Depending on the results, they need to test also their residents. And depending on their results, then they can do what are called open labs, so that people can go and visit again. Because I think we all recognize that those individuals have gone through some very hard times. However, at the same time, last week, the federal government was sending about 100 in Nebraska, it's about 178 antigen point-of-care tests to these long-term care facilities so that they can do testing free. And the testing that they have to do is relying on the positivity rate in the county that they are at, depending on what that positivity rate is. So a lot of discussions about that. What does that mean for rural communities? Because in rural communities you may have 2 people testing positive, but you only have tested 5, so that positivity rate is really high. So lots of discussion going on around there. A lot of discussion for us from the health department. How do we get those results from those long-term care facilities? Contact tracing, I just can tell you our staff is training contact tracers, new contact tracers, working very well with PRC. What's the most important thing for the contact tracers is that we have quick turnaround time. That when we get the results, that we call those individuals quickly so that they can isolate. Data analysis, always refining, and we'll also be refining our web page. And you will see more data going up on our web page. Schools, just a little bit. School opening has been going on now for 4 weeks, and I really think we all are saying it was worth all the planning that has gone into this. Because what we are seeing, I just got a printout today, we have a total of 16 cases in staff and 24 cases in students for over the last 14 days. And if you think about all the students that we have in our community, that is pretty good. We have 253 individuals who are in quarantine at this time. And I tell you, these calls every week that we have with the superintendents to kind of see, do we need to refining some of the protocols are really helpful. Our information line had again a new threshold that they passed over. They had more than 20,000 calls that they have taken. And what they are saying and what they are seeing now, these calls are really getting more difficult. They are not just calls about the, what is COVID, what does it do, or so on. They are calls about exposure. They are calls they want to have resources. What does the DHM means, or so on. So really a lot of work is going into that group. There are about 5 individuals who are there every day, Saturday and Sunday, to have our information line open. PPE, we have distributed 4 million pieces of PPE to more than 1,000 organizations in Douglas County. So, the warehouse is full blown. We have now hired new temporary individuals who help us out down there, and it is working. Opening plans, that are those plans that these gatherings, businesses, organizations need to share with us when they have more than 1,000 people taking part in those gatherings. We have now reviewed up to, I think today, it's 67 of them. Now they are really bigger events. So we have, this morning, I just approved some for CHI, the center, CHI center, and some for the zoo. So we are moving along, but it really seems to be working very well. Navigators, who are those individuals who follow up with the individuals who have needs when they have been told that they have to quarantine or isolate. We have 306 referrals that we have received just in August, where people require food or housing or transportation or something like that. So that's been working well. As of Monday, we moved into phase 4, and you probably have all heard about that. And really what that means is most everything moved into guidance. And what that means is it's not really enforceable, but in my mind, guidance is best practice. So I hope that still not a lot is going to change by this. The only thing that is still in the DHM, or not the only thing, but one of the major things is that you can only have 75 gatherings, 75% of your total capacity. So indoor, that's indoor only. Outdoor, you can have as many as you want, but indoor, if your capacity is 100, you can only have 75 people in that indoor, for that indoor gathering, and you still need to present your plan to the health department. It needs to be approved by us. Test Nebraska, testing in general, really the main testing that is going on in Omaha is through Test Nebraska. You have Oakview, Crossroad, Metro Community College down south, and you have the VNA, who is also doing Test Nebraska 1 day a week. And you have now the antigen testing that is going on. Total Wellness is a company on 93rd and H, and they are doing about 300 to 400 antigen tests a day. Those take 20 minutes to get the results, so they are really easy, and they are very well meant for individuals who are symptomatic or who have had exposure and want to know. So the positive results are highly sensitive, but if you have symptoms and you get a negative result through the antigen test, you should follow that up with a PCR test, which is still one of the best gold standards, so to say. CARES funding, we have now potentially 17 community partners who are taking part in our CARES funding, and we are developing subcontracts with them. It's going much too slow for my taste, but that's what it is. Just a little bit about clusters, because you remember I always talk about clusters. Just looking over the last 2 weeks, probably most of the clusters or the cases are in schools and colleges, and second in long-term care facilities. And we only really had 8 meatpacking over the last 2 weeks who had new cases in them. So I want to close just with sharing with you just a little bit more information or observation from our research and from our local data. First, internally, I think what we are seeing is looking at the data closely. How long does it take from an individual who has symptoms till they go and get tested? It takes, in our case, 3.4 days. That's a rolling average over the last few days. And then when they go and get tested, how long does it take from their testing time until we get the results? That's another 3.5 days. So by the time we contact you and say you are positive, there are actually more than 6 days we have passed. So if you think about it, an isolation period is 10 days, and the 6 days have already passed. Hopefully in those 6 days you haven't exposed anyone, but I do think it was a little bit enlightening data when we finally looked at this. The other thing I just want to share with you on the
go back.
Yes.
You said 3.5 to the test results, 3.5 to you.
About the rolling averages are 3.2 and 3.4.
Okay, so three days to
Yeah.
test results, 3 days to you.
Because
But the results have to go through the state.
Exactly. The results go to the state first, they then put it in a database, and the testing needs to go, you take a swab, then it needs to go to the laboratory who's analyzing it. And then once it's analyzed, it needs to go to the state in the state database, who then refers it to wherever the jurisdiction is for that person. So it's...
Are you all having conversations about cutting out some middleman stuff? I mean, do you get access
Well,
to
not
the
so
state?
much middleman, but to have these quicker. That's why these point-of-care tests are so valuable. If you get results within 15 minutes, 20 minutes, think about it. You are cutting out the whole three days.
But-
And, Test Nebraska has reported over the last months, in certain instances, they had 5 to 7 days until people got the results back. So that's a long time.
So my understanding of point of care is you get point of care. It's not exactly 100%, but it gives you something to trigger if you need the more robust test.
Correct.
So if you get point of care and there's an indication, at least you can tell them you need to isolate till you get more. Okay, all right.
That's the benefit, really, of point of care.
When the antigen test is not as reliable.
It's
I mean,
not as
right, like
sensitive.
Not as sensitive, but it's also more specific.
No, well, the specificity is, it's actually, I think it's about 95% sensitive. But if you are negative in the antigen test, it's not so specific. So it could be a false negative. So,
But they have less false positives than PCR.
Well, you know, PCR is the gold standard. PCR has actually pretty good sensitivity and specificity.
I think it's like dead virus fragments.
Oh, definitely.
That's a
We
lot
do
higher.
not know with PCR, you know, you could be positive with PCR 2 weeks, 3 weeks, 4 weeks, not knowing if that PCR test then is still infected, if that virus is still infectious. And I mean, we saw that with the Princess cruise ship individuals. They were positive for a month after. So,
I'm still there. On your 25%, you're not ruling out people being tested twice. Doesn't mean you kind of,
you know,
really 25% of the population hasn't been tested. It's about the number of 25%.
25% of the that's what we are counting, that's what our results show,
So
25.
we're not ruling out multiple tests. Like a patient who got
Yes,
tested
we are.
before. Oh, you are. You're discounting before time.
Only one,
Only one.
deduplicate.
Oh, okay. Good.
Yeah.
Okay. I get it.
Yeah. But the other thing I just want to mention to you, there is some discussion on the national level that potentially those individuals that are tested underestimate that there are potentially 3 to 4 times more individuals in a community who are positive. You know, a lot of them probably asymptomatic too. I thought some 2 interesting papers that just came out, very similar actually. They looked at the individuals who were positive and those that were negative and compared their behavior. And of course, as not unexpected, those who went to gatherings with more than 10 people were at higher risk, and those who were positive had more of those events. Those who were positive also were more using public transportations. They were visiting bars and restaurants at a higher incidence than those that were negative, and they also visited worship places more. There is another study about with a different group of people that came out, around 340 individuals tested, and they showed that the positive cases were 4 times more likely to have gone to a restaurant than those that were negative. So again, all that we talk about, those risk places are really the places where people need to take cautions. So that's kind of the report for me today. If you have any questions, see if I can answer.
Yeah, Dr. Pargat, as you know, the city council has, implemented the mask mandate. There's a sunset on that of October 20th, I'm sorry. We already have, Councilmember Festerson and I have been getting ready to introduce another ordinance that will extend the mask mandate past that. I guess my question is, should we continue to do it like on a monthly basis and continue to introduce an ordinance, or should we, because I'm hearing from folks that I'm hearing from other professionals that, we probably will be in a situation of a mask mandate for at least till the end of the year. And I guess I'm wondering, should we introduce legislation? What I'm thinking is introducing legislation that will take us to the end of the year with a caveat in there that the council can revisit it if the threshold goes below whatever number you suggest. I just wanted to get your response to that.
Yeah, potentially, even if we have a vaccine in November, December, that vaccine is probably very limited in the number of doses. So I would think we probably are in this. I do not foresee that we'll go down to beginning levels as we had in March. So it does make some sense for you to consider that. Yes.
Would it be through the end of the calendar year or through winter, the flu season?
I think you at least till next, I would think to the school year then now. I mean, because everything you're reading, you got flu season, you were in recommendations. So most likely, I would think from the language, OPS is leaning, and I don't know, I'm just saying from the language and every indicator says that they're leaning to going in. So once they go in October, I think you're gonna have that. You're gonna have, if they go in, they're gonna have winter sports, which are basketball and more intense. They probably limit the fan capacity, but still, you're gonna bring all these gatherings back together and without the mask piece. And I mean, just now I was looking, because that was one of the questions, how often do they update you? Because there's just something on the World Herald site saying that they just introduced this sweeping plan to give vaccines free, and they're noting in there that not everybody's gonna take them. You're not gonna be able to get them down, so you still, it's back into that piece of saying, you gotta have multiple fronts. And the mask seems like the most important multiple front that I don't see us getting out of until you, I guess, acquire this herd immunity through vaccination. And, you know, quite frankly, I've seen everybody in a position like ours, which is probably a discussion to have. I've seen everybody stumble over themselves saying, are you gonna take the shot? Because I think everybody's got questions about the process, but it's almost irresponsible for somebody like in this realm to say no. And so I think the mask is gonna will be around to at least the end of the school year for May.
Yeah, you know, the mask is only one tool.
Yeah.
And so we should not forget the hand washing, the distancing, and staying home when you are ill, especially now when flu season starts. That even becomes more important because respiratory symptoms are respiratory symptoms and so on. But yeah, I would say there is some value to it to prolong it till the end of the year. It's up to you.
I'm just wondering, just in terms of, because I'm trying to keep as much of the politics out of this as I can, and so I guess I'm wondering if we go to the end of the calendar year and then look at it again, or maybe go into the end of the first semester, which would be in what, like January?
First semester of
School year.
school year?
Yeah,
Oh, yes. I think their school year semester starts like on the 20th. Yes, it goes well past the winter break.
Okay,
It goes
so
like 10 days past the winter break.
I'm wondering if, because I gotta try and do it, we can get past, so.
No, but I think the philosophy is kind of like when when you think it's done, that's kind of when you pour it on. And kind of like, and this is an example I can see, it's almost like we've seen this. Florida had that gap, they went down and they just let it all hang out instead of ramping it up. So it's almost like when you see that number get lower, you got to keep the element, the washing, other stuff like that in the mask, or it will easily come. So yeah, you're gonna have a battle with a few people that are gonna wrestle to do that and want to do it. But the honest fact is, if they want any sort of normalcy, mask may be here to the end of 2021.
And I think you are pointing out something important. We want to have the economy going. We now are in phase one. We have businesses open, and we want to keep businesses open. You know, it gives us a little bit of normalcy to our lives.
Yeah.
So if we can do this, instead of having lockdowns like they have now in Iowa, bars closed, bars open again, I'm foreseeing that this is a tool that really could be helpful.
I mean, I would, just like people use the term, if you're a country lawyer, I almost feel like I read this, that I feel like I'm a country epidemiologist. But I do think if we don't keep the mask piece in place, you won't have the College World Series in 2021, just because I just think if it's lower and you have masks, you still need to keep, it just seems like even if you're gonna break social distancing a little bit, you're gonna have to have a mask on to do that. And, you know, I think if they wanna have that event close to there, you're gonna have to crush it, and the way you crush it is the mask and everything like that, to be able to get back to the normal economy piece, because at least that event is outside. And even events outside, if you are close, it's probably best to have, I mean, I read some stuff that said you should be walking around outside because of different distances, and the distances vary, so you're gonna have a battle with that with probably a few people, but I don't think it's, I mean, for instance, campuses aren't gonna let masks up. They're gonna be around all school year until the end of year. So, I don't see the school districts letting them up, so I don't see why the other places should.
And, you know, until we have this behavior change, where just automatically, if we leave the house, we put our masks on, our children take our masks with them and put them on. And that's kind of where the mandate still comes in, where just encouraging people to wear a mask may not be enough and may not get you the same result. So that's kind of, you know, it's a small price to pay for free.
Yeah, Doctor, I'm not interested in, the ordinance needs to stay in place and needs to be extended. What I'm trying to get at is
Make it clear.
the length of time we ought to do it. And so, you know, what I'm thinking is, because I think we're looking at another 30 days, and I'm thinking I might amend our new ordinance to say the end of the school year, which would be January, whatever.
Oh, the semester, I just
End of
looked
the
at.
semester.
December 11th is the last day.
But they start back when?
January 5th.
January 5th, until
At the
at
end.
least January 4th.
And even colleges, they're not gonna do, they're cutting out breaks, and after Thanksgiving, they're done. And then they're probably gonna extend the point that they're usually out for. I've seen some extend the start, like they would start the second week of January. I've seen some moving it back to the last week of January and eliminating spring break. So once you're here, they're taking you all the way through, ain't no leaving. So,
But it's nice to also have to have a point where you say,
yeah,
we are going through this until then, because it gives the public a hope.
Yes.
So I would not put it out too long, like you are saying spring. I would really consider probably the end of this year. That means, you know, we are going to revisit it again. And so there is something to be said about hope.
yeah.
Okay, then maybe what I'll shoot for is
Maybe
the end of the calendar year.
Yeah.
Let's do the end of the calendar year. That may be the amendment that I'll introduce. If unless we're talking about keeping it, I think we're still talking about 30 days. And so I want us to expand that.
On another note, Dr. Porter, you all have flu shots in?
Yes, we do. And I think the date is, I'm looking
But I
at,
think our first date is October 2nd for
so all of you, you know, the clinic over here, maybe that next Board of Health meeting, you know, get a flu shot. It's really even more important this
So they're not ready to give them now?
I think you have yours?
No, I'm just saying they're not ready to give them now, even though it's
I
in.
don't think she, I
Don't
don't,
stop by, we'll make sure you get one.
Yeah, I'm gonna stop by. So I let it go through. Okay.
thank you.
Just one more
Yeah,
thing, Dr.
go.
Ford, if we're going to do this, and I know we're going to do this ordinance, I just wanted you to be aware that the first reading will come up next Tuesday, and if you're available on the 29th
Okay.
for testimony, that's when the public hearing will be on the 29th.
I will put it on my calendar. Thank you.
So, item 4 is reports. Carrie, I don't know, but I got one question for you on that. Let me find it here. Explain to me, I saw in there, I'm trying to call it up now. You mentioned the Kresge grant, and you all might get a grant for that. Can you explain that? On your report, that,
What the grant is for that,
That's the hope of it, the diversity, or explain the context of that Kresge grant.
So as I understand it, we were part of that initial funding from Kresge. This is actually some.
This part of their funding that they did for that deal? Oh, so they make,
Leadership.
because you went through it, they're making you available for more, okay,
So
okay.
this is kind of the second phase of funding. I think they had some carryover dollars, and so all those original applicants
Okay,
now have an opportunity to apply and bring forth what they would consider kind of next steps. So we're basing our request on the Board of Health resolution around racism as a public health crisis and the development of our Health Equity Committee
okay.
and how we can begin to put some of those plans
Thank
to
you.
action steps in place.
Okay. Boom. October. So is this, we good? Because it says it would start October. You waiting for
It's
notification?
supposed to start October 1st if we get funded, so I imagine, I haven't heard anything, so I
Okay.
imagine it'll be a quick start once we find out.
Okay,
And from what Andy really took the lead and put that together, it sounds like, it's leaning toward a yes, everybody will get funded as long as they have a plan put together for the work.
okay. So, I'm just curious, so we're doing the work downstairs. So, is Andy gonna still be doing dual duty, or as that transitions more, is somebody, how's that, or he's gonna be doing dual duty for
It'll
them?
be Andy and myself and Cheryl working
Okay.
on it in conjunction with Celine and Jeannie, and then whoever begins to join the Health Equity Committee.
Okay,
But the bulk of it, probably the back end work will come from Andy and myself.
okay. All right. You got anything,
So just for the committee, our goal was to get the committee formally established. So over the next month, we'll be looking at who makes up that committee membership list and identifying that. So if anybody on the board have recommendations or from staff, please let us know.
Anybody else got comments on the reports? So my last point, Dr. Ford, before we go, you're gonna be over Friends for another year, you think? Okay. So, do you feel comfortable next month kind of outlining what you all think you're going to ask the legislature for structurally, so we can think through it? Just because since if we're asking for some structural stuff in this moment, I just want to get a feel for it.
We are starting the discussion right now to see what are we going to do next year. There are going to be, quite a bit of internal studies that we want to look at to work on some approach to. Yes, so I can bring that forward next.
Okay.
Mr. Chair,
Yep.
the other thing, Dr. Ford, is when you're setting up, how long would it take you? Because the city council, and I know the county board and others, we all do a legislative package at the end of the year for the following year. I'm wondering if there are any elements of what you're looking at in terms of addressing the legislature that we can incorporate into, our legislative ask as well, so that, again, we're providing more than one entity that's saying the same thing. This is where we need to go, state, this is what we need to do.
I think that's a really good point.
Well, I can tell you the one thing that is going to be asked for is the power for the county to have independence to do direct health measures.
Okay.
That's for sure.
And that would take the law enforcement out of it?
No, that would take the governor out of approving it.
Oh, okay.
Now, Lincoln has the hook that they got through.
Okay,
But
okay,
that would give the ability to do the health measure for the county.
okay,
So that's one that's gonna definitely be out.
okay, okay. If you, as much as you can, if you can get some of that information to me as to what you're considering for a legislative package, so that we as a council can look at it as well and see what we might want to add to, well, not add to, but support you in that and include it in our package as well.
Because even if they don't, the board is like hell bent on asking that. So we're not in this situation again. So,
Okay.
Anybody else? All right. With that, I do need like 5 minutes for an executive session. So if we can make a motion to go into the executive session for personnel matters, and then once we come out, we just adjourn, and there's gonna be nothing done.
Do we need to approve reports?
No, we don't need to approve the board. No. So, is there a motion to go into executive session
So
for
moved.
personnel? There's a motion by Gray, second.
Second?
Okay, let's